Good day, everybody. I have a story for you guys today. Several years ago, I was still study coaching in a coffee shop right in front of the school where two of my high school students and coaches were studying. Right? So I had just finished my first student, and we had this deal to make sure that he was going to be more mindful of all the stuff that he had. And lo and behold, when he left, I saw on my table that there was an item that was left there. It was none other than his school ID. Right? So I promptly call the parents and I tell them, hey, you better come here and you better come pick it up because he goes to a school where he won't be able to get in unless he has his ID with him. So my next student steps in, right? And we make a coaching contract for him to never forget to look at his to-do lists, which were inside his notebook. And after he finished the session, lo and behold, on the table, he left his notebook on the table. So once again, I call up his parents and say, hey, if he needs to, if he's going to be accountable to me, he's going to be productive in school, you're going to have to get this right now. So the parents come in and go back for the notebook. And so, knowing that I was done for the day, I go down to the parking lot, get inside my car, and realize that I had lost the parking ticket to the building that I had come in. And I looked for it, wasn't in my pocket, wasn't in my wallet, and then so I went back. And a good thing, the restaurant was just about to close, the waiter was just about to collect everything there, and lo and behold, on the tray was the parking ticket. So once again, good day everybody. This is John Maria from Project Pond, life coach, study coach, and special education teacher, or whatever you want to call me. I'm here to help out your middle schoolers, high schoolers, and college students overcome their neurodevelopmental difficulties. I hope that the story illustrates to you guys that I think losing an item here or two is pretty common for anybody to encounter at multiple points in their lives. But what are the odds that it would happen to three people with the same diagnosis? So of course, I'm talking about ADHD, or Attention Deficit Hyperactivity Disorder, which is the topic of our video today. Today, we'll be talking about three parts of ADHD. First of all, its history. Secondly, what we know so far. And third, what direction the research is going. And I'm hoping that this information will be new for many of you, even though you guys have been aware of ADHD for quite some time. Many of you probably have a relative or you yourself are diagnosed with the condition. There are a bunch of things here that I hope will be new and useful to you. First and foremost, let's go to history. The first mention of ADHD as a legitimate medical disorder was referenced back in 1902 by Sir George Still, who was known as the father of British pediatrics. And the quotation in his book basically said that there is this defect of moral consciousness, okay? None of this is politically correct today, but I just want to tell you guys that that was the word that they used back then, defect of moral consciousness, which cannot be accounted for by any fault of the environment. So in other words, even as early as 1902, we really understood that whatever this condition was that appeared in many of these kids, it wasn't the cause of the environment or by faulty parenting and things like that. There were just some individuals who were born a certain way, and it had something to do with moral consciousness, which at the time, of course, we now know it properly termed as behavior. So it wasn't until many years later that we would actually see the diagnosis, although there would be different types of medication to help out children in the practice of psychiatry in the 30s and in the 50s. But the diagnosis itself, I first appeared in the second edition of the Diagnostic and Statistical Manual of Mental Disorders, or known as DSM. This is published periodically by the American Psychiatric Association as a manual for these doctors to diagnose these different mental conditions. So the first name for it was hyperkinetic impulsive disorder, which is, when you think about it, when it describes people who have hyperactivity issues, isn't too inaccurate. But it wasn't until 1918, the third edition of the DSM, that ADD was mentioned as a disorder. So there was this idea that some certain people couldn't pay attention to tasks, and you saw this impairment in some of the students who are in the classrooms who can't pay attention and things like that. It was in 1987 when they put two and two together and they saw that the hyperactivity symptoms as well as the inattentive symptoms were really like rooted in one condition, and hence they finally coined the term ADHD, or Attention Deficit Hyperactivity Disorder. And in 2013, in the latest edition of the DSM, it included criteria for diagnosing adult ADHD. So it shifted it from almost solely being a pediatric or a child's issue now to that of also an adult issue. So today, when you look at the diagnosis of ADHD, I'm going to simplify it for you guys because there are a lot of technical terms in here. I'm going to try my best to do that. So today, we now understand that there are three types of ADHD. This is very easy to remember. The first type of ADHD is similar to ADD. Okay, the technical term is ADHD inattentive type, but basically this is the type of ADHD that might have that will give a person problems when it comes to their inattention and just managing themselves overall, but without the hyperactivity issues. The second type of ADHD is the primarily hyperactive and impulsive type. While the third type of ADHD is the combined type, so the person has both of these impairments within themselves. I myself am diagnosed with a combined type ADHD, like for example, and my wife is diagnosed with an inattentive type ADHD. Right? So now we also know that just to be 100% sure that a person really has ADHD, the manual states that you want to get data from 0 years old all the way to 12 years old just to be completely sure. In the previous addition to this, I believe it was up until 7 years old. I think that this change was pretty helpful because sometimes when, especially with issues with attention, managing themselves, as well as hyperactivity, there are many stages where these things are normal when it comes to the age levels, and sometimes perhaps it could fool certain clinicians, parents, and things like that, it might already be the neurological condition ADHD. But I think when you go from 0 to 12 years old and you check that child's history and you see that 12-year-old kid or 11-year-old kid still is standing up in the middle of class, right, and running around, you know that there really is an issue rooted in his or her brain or his functioning. Okay? And the other thing that's very important here is that it must be persistent in daily living in multiple settings for a considerable period of time. So, a week or two might just be the sugar rush from my toddler, 2-year-old daughter. But when it goes on for months at a time, you know that there is something that needs to be addressed. So that's where we are when it comes to diagnosing ADHD as of today. But if you were to ask me, I really don't think that just diagnosing is helpful. In my line of work, what's more important to me is to characterize the specific strengths and, in this particular case, weaknesses of a person so that we could help themselves and to identify the things that they need to work on. And as such, one of the most helpful perspectives of looking at ADHD is to look at it as an executive functioning impairment. So many professionals today, occupational therapists, psychologists, doctors, lean towards this type of intervention, this type of assessing individuals with ADHD, and I myself count myself among those individuals. Okay, so this was from a study, I believe in 1997, by Dr. Russell Barkley. Dr. Russell Barkley is one of the most published doctors on the topic of ADHD, if not the most published doctor on ADHD. And basically, this is a very technical paper, so I'm just going to simplify it for you guys. I believe that he shifted. I would describe his paper and his perspective as shifting it from just the outside, looking at behaviors. Oh, you look at this kid, he can't pay attention. You look at this kid, he's running around. Look at this kid, he can't control himself. So he looks at it. He doesn't stop at just observing the outside behavior, but also to characterize the internal workings of a person, the inward behaviors, the mental thoughts and processes. And he basically added a few things there, like a person is unable to internalize his or her speech or to talk himself out of it, right? And that's why there's an impulse control issue. There's also the idea of emotions and emotional control being an issue there. And this has been used by a lot of professionals and has been worked into a lot of perspectives in helping individuals with ADHD. But perhaps my favorite way of assessing and applying This lesson comes from Dr. Peg Dawson and Dr. Richard Guare. Okay, the first book that they published on this topic is so aptly titled. It's called Smart But Scattered. I think this is the second time I'm referencing their book, so you can get a copy of it online. It's easy to buy it. You know, I'm not being paid by their office or anything like that. I'm just telling you their books. Okay, this one, Smart But Scattered, is generally for pediatric cases, but they've also written books for teens, and they even wrote a book for us coaches, which is pretty cool, right? But their idea of assessing for executive functioning is to divide it into 11 different executive skills. So that becomes helpful. So it's not just about hyperactivity. It's not just about paying attention. It's not just about being impulsive. They also check for the other things that Barkley specified are part of the difficulty of ADHD, such as being able to initiate tasks, being able to manage your time, being able to plan ahead for the things that you need to do, being able to look at yourself from a third person perspective, being able to follow through with long term tasks, and many more. So they specify how to assess for these things as well as how to address them. So, yeah. By the way, spoiler alert, one of the ways to address them is to get somebody to help you, like a life coach or an occupational therapist or a psychologist or somebody in school who's familiar with these things. So that's what we're here for. Okay? Okay, so if it stopped there, that would be pretty cool because this is already a very helpful way of looking at ADHD. But there are actually a bunch of other things about ADHD that I'd like to mention. Okay? One of which is that ADHD, okay, is a general issue among those with neurodevelopmental difficulty. So this means that the symptoms of ADHD can be said to describe every other neurodevelopmental difficulty. Okay? Just to tell you guys, since we're talking about DSM and psychiatrists diagnosing different neurodevelopmental conditions here, did you guys know that prior to 2013, which is DSM-5, in the fourth edition of DSM, it kind of stated there that when you had a person diagnosed with autism, there is no need to diagnose them with ADHD, an additional diagnosis of ADHD, because it is implied that they will have a difficulty with ADHD. And that relationship of autism to that of executive functioning, in this case, the impairments of ADHD, is pretty much real. Almost every client I deal with, not all, but every client I deal with who is diagnosed with autistic spectrum disorder will also have the difficulties, specifically the executive functioning impairment associated with ADHD. Although in the fifth edition of the DSM, they said that you can diagnose them separately just to be more helpful in addressing these impairments. So the point here is that when you look at individuals with neurodevelopmental difficulty, they may have specific things that are specific to their condition, but more or less you will see some ADHD in them, which is why I also mentioned that this video is important for anybody on this channel to watch, because a lot of these difficulties will definitely apply to you. This is also true when you look at popular media. For example, there are movies about autism and dyslexia as shown here. So these are movies I would recommend. So there's Adam, which is about mild autism or Asperger's syndrome, right? We'll talk about that on a different video. And there's Taare Zameen Par, which is about dyslexia here. The interesting thing is that when you look at a movie like Adam, right, it wasn't just the social issues that he had as a person with autism. He also had trouble managing his time at work, which eventually led him to getting fired. Same thing with the Taare Zameen Par. It wasn't just dyslexia here wasn't portrayed just as a condition that disabled a person from reading properly, but also the person's ability to manage his or her emotions, as well as to remember what time it is, and manage time and things like that, which I think are very accurate portrayals. Now, I don't know if the directors of these movies knew about executive functioning impairment among other people with neurodevelopmental difficulty, but there you go. Okay? So, some other useful information about ADHD. First and foremost, we do know that it runs in families. No one cause explains it, so we know that there's a genetic factor. Okay, we also see some symptoms in individuals who have been raised in neurologically less than ideal environments. So it could be possible that you're not really born with ADHD, especially in this world today. We see a lot of people just on the phone. They let the phone take care of their kids and things like that, which is of course not so ideal. I don't think that's a new idea to anybody. They will have attention issues and many of the other issues associated with ADHD, even though they don't have the neurological tendency for it. And lastly, this is something I want to emphasize. When you have ADHD or any other neurodevelopmental difficulty, there's usually a higher likelihood that there's a comorbid health issue, and like depression and conditions like that. Okay, but so where are we going now with research? I promised you guys to give you guys an update. Well, this is really cool. You know that there's actually a link between ADHD and physical health, specifically when it comes to allergies and autoimmune conditions. So in 2017, in Taiwan, there was conducted a nationwide study in which they managed to get a total of 8,201 participants who were identified with ADHD. And they found that ADHD was related to having ADHD was related to having allergic rhinitis, asthma, atopic dermatitis, urticaria, autoimmune thyroid disease, which is what I have, ankylosing spondylitis, ulcerative colitis, yeah, and all of these conditions. So these are autoimmune allergy conditions. And in my experience, I have never had a client in more than 10 years that didn't have an autoimmune or allergy issue. Like I mentioned, I have a thyroid problem. My wife has boils every once in a while that pop up on her head and things like that. So what does that tell us? You know, when people say that ADHD is not a real condition, oftentimes they think it's all in the head, that it's just related to a motivational or some sort of discipline issue. Well, this one thing I found whenever I talk to people in this manner proves to them, at least, there's a physiological component, that it really is a medical condition. So this, in a way, ADHD is deeper than just behavior or looking like we're spoiled, but actually has some very real trouble in the form of these conditions. Okay, so one last thing I just want to say, that ADHD is real. So you know anybody who does that, just tell them that relationship. So we're still developing studies when it comes to that. I am confident that within the next 5 or 10 years, we're probably going to see the trend once again evolve. You know, just from looking at it from an executive functioning perspective, and now also looking at the physical health side of it. Okay. But here's what I want you guys to also remember, okay? The game, regardless of whether or not you have this label, you have this condition, when it comes to dealing with people with neurodevelopmental conditions, we do this. We focus on strengths while compensating for weaknesses, okay? So I know that I discussed a lot about impairments today, which are inherently weaknesses, but you know, maybe in a future video, we'll discuss how to find the strengths for those individuals with ADHD. So with that, I just want to tell you guys, thank you once again for supporting our videos. Please like our page, subscribe to this YouTube channel, and join in the conversation in our Project Fund page, all of which will be linked below. All of the sources cited within this that I've cited on this video so far will also be below. Please comment whatever thoughts you have. We'll try to respond to you as soon as we can. Okay, and with that, have a good day and God bless you.